of just follow, gonna go over the main points here. Today's topic is gonna be stroke and stroke rehabilitation. Have you ever had a patient who was post-stroke who you took care of?
Uh, Not recently,
Mhm.
but yes, I have.
Okay,
I'm familiar with.
very good. What was it like when you were taking care of them? Were they weak? Did they have any cognitive issues?
Initially, they were weak.
Mm-hmm.
It's actually someone who had a stroke
Mm-hmm.
and then had another stroke
Oh boy. Mm-hmm.
while driving.
Oh boy, how scary.
Yeah,
That's terrifying.
but yeah,
And they survived, so
and they
that's a
survived
miracle in
in
itself. Oh
itself.
my
Yes.
gosh, that's really scary. Okay, so we're gonna talk about some basic types of strokes. There's 5 basic types. Um, some kind of 3 aspects based off the American Stroke Association, and then some kind of symptoms that people have afterwards. And then impairments, some types of paralysis, and kind of how to treat certain types of strokes. So what we're gonna look for from a caregiver nursing point of view. Okay. All right. So this is pretty updated. I kind of try to look up the statistics year to year, but it didn't change much. But there's 797,000 new stroke victims each year. So a lot of people are affected by this. And 4 million of those are survivors. So just worldwide. All right. So a lot of people, you either know somebody or have a family member who's been affected by a stroke. 1 in 4 of those people have had a reoccurring stroke. So like your patient. Okay, so it's really common for them if they've had one before to get one later on in life. And there's not real, they usually say 1 to 3 years is when you will have your reoccurring one, but there's just signs and symptoms to look for that might be leading up to that. I know.
Now, what are the statistics for reoccurrence?
So usually it's about 33% of them are gonna have a reoccurrence, but there's different factors involved in that. So it's gonna be your people with comorbidities like diabetes, hypertension, people who drink alcohol frequently, smoking. So things like that can also contribute to them having a reoccurrence, even more reoccurrences of stroke, or just more frequently in a shorter amount of time.
Right.
Okay.
Okay.
Also your people with the cardiovascular disease as well, of course. Okay, so only about 5% of people gain full function after their first stroke. So you might have just a little bit of residual. Some people are much more affected. You might hear about people having mini strokes, the TIAs, and those tend to not have none to little of the kind of reciprocations of the stroke. But for the most part, people are gonna have something that they go, oh yeah, since I had the stroke, I have more memory loss, or I have more less function in my arms or less function in my legs. So for the most part, not many regain total 100% functionability after that. Functionability, I'm gonna made up that word. Function afterwards. Okay. And so a lot of these people, they do live with their impairments. They might need increasing PT, OT, things like that at home to regain their function and their independence at home. You see a lot of these people after they get out of the hospital, they have a whole course of physical therapy to kind of just get them as much to their old self as possible. So what is a stroke? So a stroke can also be called a CVA, which is a cerebral vascular accident. Um, and it's a change in the disruption in blood flow to the brain. So there's different types of strokes that we're going to be talking about, but the basic 2 types of strokes are going to be your ischemic and your hemorrhagic strokes. So ischemic is the most popular. That's going to be about 85%. I think we're on page 3.
Yes.
Um, it's going to be about 80%, 87% of all of your strokes are ischemic. And that's when your artery that supplies the blood flow to the brain becomes blocked. Okay. So those are very severe.
Could that be from like plaque or
Mhm.
something? Okay.
Yep, yep, you could mostly a blockage. So, a lot of people with like high cholesterol, that's kind of a main sign of it, is they can have the plaque. Mostly here you'll see it in their carotid. They'll have some people get tests and they'll go, oh, you have 80% um, plaque on this side and 20% on this side. But when it starts to build up, it just makes sense that you would have that pressure in the brain and then that cause a disruption of blood flow. And that's almost like an earthquake, is the best way I can describe a stroke. So your brain is sitting there and all of a sudden it's got too much pressure and it starts going like this and you have a stroke. So it's kind of the best way of
Interesting.
of describing it.
Yeah.
Also, like, have you ever felt like a mini earthquake and then all of a sudden you have a big one? Similar to that, it's like a TIA, a mini stroke, and all of a sudden you're like, oh crap, the big one's coming. So, not so, not good. Whether that we're having today. Okay, so there's different types of blockage in the brain. We have our thrombosis, and this is where a large artery is blocked. Um, this can be, like Kelly said, from hardening of the arteries. This mainly, and this is going to be a test question, this mainly occurs in the elderly. So this is like your main thing. I think they call it MCVA on there as well. There's also the small arteries that can get clogged, and those are your lacunar infarcts. These are going to be most common in people who have hypertension as well as diabetes. And then your embolies, and those are they travel through your arteries to the brain. They block a vessel, and they're mostly found in the middle cerebral artery. So those kind of are interesting, but those mainly occur with your people with your heart disease, your with arrhythmias, AFib, or people who have had previous heart surgeries. So you'll see those kind of strokes kind of come to fruition. Your cryptogenic strokes, these are kind of frustrating because they have no known cause. So some people who have reoccurring cryptogenic strokes, it's like they can make lifestyle changes. They might be from birth defects. And so they're finding that more and more. They're also finding, I'm not getting political, but that certain vaccines that people are not like reactive to, they're reactive in a different way, are getting these cryptogenic strokes, and we don't really know why certain shots or and COVID's kind of political, but like the shingle shot, they're finding more and more cryptogenic shocks. Cryptogenic strokes are from the shingle shot.
Interesting.
But millions of people have gotten the shingle shot and been fine. So
Yeah.
it just really depends person to person. Okay. So it's not like don't get your shingle shot.
No,
You know.
if you have that type of reaction, that would happen sooner rather than later.
Totally. Mm-hmm.
Okay.
Mm-hmm.
All right.
Yep. It would.
Had my shingles.
Yeah. Did you?
But it's been a while.
Okay. I'm like,
Yeah, just wanted that certification.
You're probably safe.
but they do fine. They go, oh crap, I was totally fine, and then I got my shingle shot, and all of a sudden I had a stroke. So
Right.
it's just everybody's bodies are different. It all reacts differently. Everybody wants to kind of blame for things too.
Right.
So anyway, okay, moving past that. Your hemorrhagic stroke. So this is going to be a rupture in your cerebral arteries. So this is when the brain is lacking oxygen and nutrients to it because the brain has swelled to a certain point, and then the blood vessels and all of that breaks. Okay. So with these, you're gonna have bleeding into the brain, and this is gonna cause some of parts of the brain to start to temporarily die. It's very serious. You're gonna see it a lot with your drug addicts who take the uppers. Okay, so you're gonna see it in a lot in your cocaine addicts, meth, things like that. Again, hypertension is really common when you're using those types of drugs. And it's just your brain can't take it.
Is it
Um,
like trauma based also, like you hit your head?
it can be, yep,
Okay.
you can hit your head, also brain tumors as well, so anything really that's gonna cause a major swelling on the brain. I've known a firefighter in the past who he got into a motorcycle accident. Sorry, Kelly.
I know, she looks right at me.
But got into a motorcycle accident on PCH and ended up having one of those intercerebral hemorrhages. He was wearing a helmet,
Mhm.
but impact and yeah. So your brain just it can only swell so much because you have the skull on top. So a lot of times
Right.
you'll see these patients need to have an opening into the skull so that the brain can have space to swell. And a lot of times these people have major strokes. That's what this firefighter ended up dying of, was a stroke from the swelling, and then he got a clot, died. So really sad, 23-year-old kid. So really sad. So sorry, Kelly, not just scary, but always, always wear your helmet.
There's always a lot of.
As you do. We have our intracranial hemorrhages as well, and then these are gonna be when an artery bursts as well, but these are more like an aneurysm, also a test question. It happens in the circle of Willis of the brain, so these are your intracranial aneurysms. A lot of these are going to result in death, because the cause is not clear on these as well. So it's like, you go to the doctor, you get checked up, but how often are you getting an MRI on your brain? Not very often, unless you have a headache or you have something like that. So really scary when you don't have a clear-cut cause of something because you're not looking for it. So a lot of these do result in death. We have our AVMs, and these are going to be found more in young people. So these are hemorrhagic strokes as well, but they're found in little kids. Um, which you don't really think a lot about little kids having strokes, but they can. And those are going to be your congenital issues, a lot of heart disease as a young baby. Those can cause these kind of strokes. Okay, very good. So it kind of shows you in your literature here kind of a little image of what the skull looks like, but you see you kind of have a lot of layers before you even reach your brain tissue. So you can imagine how much it has to have a big impact to finally get to your brain. So of major heart attacks, 3% have a second attack within 30 days. So the 33% that I said earlier are kind of your basic, but the major ones are going to be within 30 days. And then 1/3 of those within 2 years for major strokes there.
Right.
Mini strokes, like I talked about, and that's what it says here. Mini strokes, and some patients will tell you like, oh yeah, I had mini strokes, and they kind of make it not a big deal. No, that really is. What have you been doing to kind of lower your chance of getting one again? You'll see them out there, they're smoking, they're drinking alcohol, they're doing all these things, they're not taking their blood pressure medication, even though the blood pressure's through the roof. We really need to be careful of those patients and say, okay, we need to make some lifestyle changes so that you don't have stroke, or a major one.
So I know someone who had probably classified as a mini stroke.
Mm-hmm.
Who's on a lot of different medication.
Mm-hmm.
There wasn't any trauma or anything to the head.
Mm-hmm.
But then she continues to drink a lot.
Mm-hmm. Nope.
She's gonna have another stroke.
She got it. And most of the time in those patients, you see it happen when they're sleeping.
And she's 29.
Wow.
She's young.
Wow. Mm-hmm.
Yeah, I know people have addicts that have had heart attacks at
Mhm.
2021.
Mm-hmm. It's not so much your brain, your heart, your major vital organs can take.
Right.
They can take a lot, but eventually it catches up with.
We abuse our bodies.
We totally do. We totally abuse our bodies.
Uh-huh.
And you see it. I mean, sometimes you even see really healthy people who have heart attacks at
Yeah.
like 30 years old.
So it's like
Oh, what the
that
heck?
Biggest Loser coach Bob, whatever his
Mhm.
name is, had a heart attack at like
Mhm.
55. Yeah,
Wow.
he's a physical fitness instructor, you know, like
Yeah.
super healthy.
But it doesn't mean he doesn't have stress in his life.
Totally.
Very true.
And exercise does put stress on your body.
Right.
You know, it's healthy, but to what extent?
Right.
Mm-hmm. You know, you just never know.
Fascinating.
I know. I knew somebody who ran like 15 miles a day and dropped out at 50. So I'm like,
That's why I stay fat. I don't have a heart attack or stroke.
Okay, so your mini strokes. So this is where the 33% comes in. 33% of people who have a mini stroke will have one within a year. Okay, have another mini stroke, if not a big one. So people like this, very similar. We're gonna have a big trend here, but it's especially males who have these. And they're mostly gonna be diagnosed with a history of diabetes, hypertension, or cardiovascular disease. So it's really interesting how the heart plays so much into the brain. And it makes sense. But
And
it's just-
TIAs will actually cause dementia,
Mhm,
which is
Yep.
yeah, it's
Yeah.
called vascular dementia.
Yep.
Wow.
So your cryptogenic strokes, these are the ones that can't be determined. So like I said, it's hard to really diagnose them until they happen. These have a higher frequency in our African American and Hispanic groups. Also with patients, we find these with who have AFib, a hole in the heart, and these mostly occur at birth. So they just don't know that they have a hole in their heart, and then all of a sudden, they get it diagnosed. They have these kind of
So
strokes.
with the African American community
Mhm.
and the Hispanic community,
Mhm.
then that's primarily diet. Is it
Sometimes
safe to say that?
it is
Because although with his Hispanic diet, they do a lot of spicy foods, which is good for heart and enlarges the blood vessels, right?
yeah,
So blood flow,
it can.
but there's also a lot of salt
The salt is the main thing there.
in African Americans.
Mm-hmm.
A lot of salt.
Mm-hmm.
Same with Hispanic.
Mm-hmm.
Right.
Yep. And which I'm not saying everybody should be vegetarian, but also meat as well with the Hispanics. So you have your spicy, specifically with Hispanics, the spicy and then the fatty meats as well. So there's a high fat content, and then that wreaks havoc on the heart, and then therefore can cause more of the plaque contributing to strokes. So
Yeah,
we see a lot of our Hispanics have hypertension.
right.
Mm-hmm. Yep. And diabetes as well. Mm-hmm. And a lot of our African Americans have diabetes as well. Mm-hmm. Yep. And some of them, it's just genetic too. I mean, our genetics play a big role in it. So you can eat right, and sometimes your genetics are just against you. So I know it's really sad.
Yeah.
Sometimes you could do everything right,
I
and
know.
you're like, darn it.
My dad has high cholesterol. I have high cholesterol.
Yep, I did too,
Right.
and I
It's all
fine.
genetic.
Yep, totally. Okay. All right. So we have our stroke assessment. I'm gonna breeze through this because it's a little bit boring. But there's things that the American Stroke Association kind of uses for classifications of a stroke. They go by number of domains, degree of impairment, your functional assessment. There, and you don't really have to study this. It's just how they classify a stroke and its severity. Sometimes, specifically when we go into a home and start like a home care case, when somebody suffers from a stroke, we do have to fill out this assessment to show how much care is needed. to kind of get them up to that function that they were before. And sometimes they can go from like a level 7 to like a level 2. So, and that's the goal. I mean, obviously, we want them to get better, but that's put through a lot of physical therapy, us helping them. Some people are weaker on one side, so we put that in the care plan that you have to stay on the weaker side while they get better. So, kind of things like that. Again, don't read too far into this. You're not going to be quizzed on it, but it's just kind of nice to know how they scale it.
Right.
And then there's a stroke scale. So have you ever heard like the stick out your tongue and put your arms up in the air? Yeah, okay, so very good. So if you have a patient put their hands up in the air and one arm is dragging to the side, or they can't stick out their tongue, or they start slurring their words, those are good stroke tests to tell if somebody is either going through a stroke or they're
Or they've had one
yeah.
recently?
Mhm.
Okay.
Yeah, and pretty frequent. Is you can kind of tell, you might see some facial drooping as well. That's a really clear cut sign that they've had it. I know somebody who's had a stroke before, and she says, every time I think I had another one, I start sticking out my tongue and looking in the mirror. She does the stroke test on herself. I'm like, you're too cute. Okay.
I would do the
I
same.
I would do the exact same as well. So that brings us to our next section. So the motor, you might have your paralysis. Some people have a stroke and all of a sudden they can't feel just like their fingers or one side of their hand is affected. So that's kind of strange. It might not affect like a whole body side, which is what we see most frequently. It might just be like my hand just doesn't work anymore, but they can like lift this arm, but not the hand. So there's really like awkward parts that can be affected. We'll talk about that a little bit more. Some people might have like just behavioral issues. So the family will go, we don't know what's going on. All of a sudden, mom is really impulsive. She's starting to like drive super fast or doing things that are dangerous, and it's a very stark change for her. And that also can be a sign of a stroke. So you have to think about it. Your brain is responsible for making decisions, right? So you're like, that might have been where the stroke occurred in the brain, and all of a sudden that's disrupted.
Like the frontal temporal
Mhm.
part, or
Yep. So they're not perceiving things correctly. And also sometimes they might just become really depressed all of a sudden. You know, what the heck is going on? So again, it just depends where in the brain it occurred. You can only really diagnose it through getting a scan of your brain, and not everybody gets diagnosed right away.
It's like a blame behavior on,
Yeah,
maybe I'm an extra.
I know. If you want to justify your bad decisions, I just had a stroke. Don't worry about it.
yeah, it wasn't a midlife crisis. It was just a stroke.
Exactly. Yep. So these are what I'm explaining here. These are going to be on your right side of your brain. For also you might have short-term memory loss. You could be easily distracted. That's me all the time. Difficult finding objects and understanding maps. That's me all the time. Those are right-sided strokes. With your right-sided strokes, your language should be intact. Okay. On your left side, you might have either you can't understand what somebody is saying to you, or you can't express yourself and speak to them. So there's two different kind of aphasias there. Your left side as well, you also might become easily depressed, but you're going to be more slow and cautious. So it's kind of funny. Your right side, you're very impulsive. Your left side stroke, you're going to be cautious and aware of things. And then with your left-sided stroke, you're gonna have right side deficit of the eyes. So it's interesting. So that's why it switches. You'll see if somebody had a right-sided stroke, the left side is paralyzed. So kind of switches up a little bit. Strokes in the brainstem are serious, very, very serious. Your brainstem controls almost everything. Brainstem attacks, these often result in immediate death. If they don't, people tend to go into a coma. They get hypothermia, so they just can't regulate their body temperature and they get hypothermia. You're gonna see a lot of these patients become quadriplegics as well. So really serious, strokes. All of these are not fun. Nobody wants to have any of these, but your brainstem ones are severe. Um, and then in your cerebellum, you should know, is based off your balance. So a lot of these people will walk in a very interesting manner, almost like they have MS, but severe MS at that point, or they'll have like vertigo. So horrible vertigo, they'll have a lot of nausea, vomiting, things like that when you have a stroke in your cerebellum. Okay. So again, none of these are going to be fun strokes here. Types of paralysis. We have, like I said, paralysis of one extremity or one specific part of your body. Your dipleggia, that's going to be on both sides. So both arms are paralyzed, both legs are paralyzed. Hemi is going to be one side of the body, left or right. Para is going to be both your lower extremities or part of your trunk. So some people just think it's just like below, but sometimes it's also their stomach and they develop gastroparesis as well. So they can't digest food. And then they have to have some form of a G tube or something like that from a stroke. And then your quadriplegics are going to be all four extremities and most of the trunks. And so those are going to be found in your brainstem patients who have the brainstem strokes. So I'm going to kind of breeze through a little bit of the new trends in post-stroke rehab. We should be on page, is this long one? 11. But strokes are going to be classified to the length of time since the event. So acute is 3 months, subacute is 3 to 6 months, and then chronic is more than 6 months. So it really also depends on where your stroke occurred in the body and how severe it was. So, like I said, your TIAs are not going to be super severe strokes, so you might not have any symptoms, or they'll be very acute. Like your brainstem strokes, where people are quadriplegic, obviously those are going to be your chronic cases. They're going to need ongoing physical therapy. If they're laying in a bed, they're going to be needed to turn, but they lose a lot of their muscle mass at that point. So they're going to need the range of motions constantly. That's like our friend who does our filming, his wife has that. So yeah, I mean, it's extensive. It's extensive and expensive to have that kind of care.
Right.
And you could only hope, they have Medicare to help with that, but private insurance, I mean, it's a fortune to be put in this position where you have to have so much just to keep your quality of life and just to keep
Even stay alive.
yeah, exactly. Okay. So some of this kind of gets into some scientific stuff. I'm gonna skip down to what are some new therapies being used for rehab here. So it should be page 15. Are they labeled?
No.
Oh, I'm sorry.
I'm sorry.
Okay. So there's a couple of things that people are doing now that for stroke, and they're if you constrain a certain extremity, so before they were just doing like the whole arm, now they're actually using singular therapy to like strengthen the wrist, strengthen the fingers, strengthen the arms, all by section to section. And they're finding that has more of an effect on the therapy than just passive range of motion where we would be doing like arm circles or up and down. That's really just exercising this major muscle right here. They're finding that if they do, and mostly with the arms, singularity exercises has actually given people more functionality, specifically in the arms. With the legs as well, I mean, we don't use our toes for very much stuff. So they're really focusing a lot of this in like the fingers and the hands. But you can use it, I guess, specifically with the legs, but this is just the new stuff that they're doing is they're using kind of special mitts as well. I was reading online too, kind of ice therapy. Have you guys heard of like cold capping for chemotherapy? Okay, so there's certain things like if they do an ice therapy, it's almost mitts on the hands, and just because the hands might be paralyzed, it's actually stimulating the nerve endings so that when they're doing the therapy and the movement, it's warming those nerves up from a cold setting, like almost like an ice cold setting, and they're actually finding more functionality within the nerves. So strokes will obviously affect your nervous system the most. So if they do the ice capping on the hands first and then the movement, they're finding that people have more success. So that was another thing I was reading as well. Um, active assist, and this is going to be task specific types of repetitive exercises. So, this is going to be relieving spasticity, kind of getting people into I don't know if you've watched videos before of like in old folks' homes where they have like what is it called? Where you put the face mask on. You know what I'm talking about? Like the AI, but it's not virtual reality.
Oh.
That's what it is. I'm like, I know what it is, but I'm trying to think of the word. So like the virtual reality. So they're using that as well for rehabilitation.
Oh,
so it's
neat.
almost like a task, like you're cooking, but they don't actually have these people cook. They have it in virtual reality. So they're doing that. We're using so much more virtual stuff
Yeah.
these days. Body weight supported treadmill training as well. So sometimes people will be in like a sling kind of to hold the pressure of their body up. And then they do the walking motion, but it's not so heavy. It's almost like walking on air when they're walking on the treadmill. And then as they progress and get stronger, the sling, I'm like looking at the sling behind you as I do this, the sling lowers your body so that you put more pressure on the legs. So it's kind of giving you like a very lightweight walk to a heavier as you get stronger. Okay. There's kind of a picture. Sorry guys, that's it there,
Oh yeah,
Kelly.
the robot assisted movement.
Exactly. Yep. So they're using that as well. They call it RNEO. So 3D, it kind of just allows you, I think it's very motivating for people to kind of um use this technology to help them as opposed to being in a real setting because it can be really embarrassing. Like if you were in Albertsons and you can't grasp an apple, you'd be dropping, you're dropping things. This kind of gives you it in a very safe place until you can get strong enough to do it in a natural setting.
Right.
That's how I'm choosing to look at it because I'm really not all on board for AI yet. But I think, in these cases, it can really be beneficial for people just in
Right.
a non-humiliating way. Okay. And then the next page kind of shows you that harness that I was talking about on the treadmill. So I'm kind of explaining it in
Oh yeah.
very short terms. It looks crazy.
It does.
The girl.
Wow.
Yep. So it really just supports your weight.
Auto ambulator.
Mm-hmm. Yep. Pretty cool that we
Yeah.
have all these things now though, right? Before you just used to be in a bed and
I
figure it
know.
out, and you'd have a nurse who would just be like moving your leg like this
Yeah.
left and right. Now we have so much technology to help us.
Recumbent cross trainer.
So I have seen that before, the recumbent cross trainer as well. That can help build up your abdominal muscles, but also just kind of obviously strengthens your legs, keeps you moving. We see that a lot in our patients who have like MS as well, just to kind of keep the muscles working.
Right.
And then also the electromyographically triggered, oh my gosh, wow.
Wow.
EMG NMES. So this is kind of like a 10 system. It's gonna have your electrical stimulation for your patients there. This is mostly found in patients who have like hand or leg work, and it just kind of signals those muscles to start working. So it'll show like if you were moving, like doing a certain task, it's kind of giving the brain those electrical signals and then kind of firing them back.
So like it says to reduce foot drop,
Mhm.
and then like, you know how when people don't use their hands, they get, what is that called?
Like, oh,
And it's hard to pull them out.
contractions.
Contractures.
But yeah.
Yeah.
Mm-hmm.
So would it help with contractures
It could,
too? Okay.
yeah, I would think it would. I think you have to get it pretty quick, like early before it becomes so tightened like
Yeah.
that, then you would need more of a surgery. But yeah, I think it would definitely help for that. Okay, yeah, and then reduce foot drop. Perfect. So yeah, these can be fantastic little items to suggest if you have patients who need these things.
Mhm.
So
There are so many.
all the electrical stimulations kind of work the same. Some of them, this one on the next page, the Ness H200,
Mhm.
this one wraps mostly around your wrist. It's very similar to like, you know, when you have your Parkinson's patients as well, kind of just getting them used to a different tool
Mhm.
in order to complete these little simple tasks.
Right.
Okay. All right, let's see if I missed anything that was gonna be on our quiz here. I didn't see anything that had to do with all these millions of devices. I think that's all. Let me see. Do you guys have any questions so far?
Oh.
No? Okay. All right, let's do our quiz. We're just gonna do the first 10.
Okay.
Okay.
Yeah.
And you obviously can use your literature if you want.
So it's an open book
It's
test.
open book test here.
Okay. Stop the recording on this.